Hi, I'm Dr. Earl Stephenson, Jr. of Signature Plastic Surgery practice here in Metro Atlanta, specifically in Gwinnett County. I'd like to talk to you a little bit today about tummy tuck, or commonly known as abdominoplasty. Abdominoplasty or tummy tuck is a very common cosmetic procedure performed mostly for women, but can be performed for men, which basically contours the abdominal or tummy wall to produce a sleeker shape and better figure. Tummy tuck or abdominoplasty is done as an outpatient surgery. It basically takes any loose skin that is below the belly button and is removed, and it also tightens the tummy muscles. Good candidates for this procedure would be women who've had babies, men or women who've had massive weight loss, or people who've had some hereditary problems where they actually have some laxity of their tummy wall and have excess skin and fat. As I mentioned before, it's an outpatient procedure done at Emory Eastside Hospital, where I currently practice. The procedure itself takes about 4 or 5 hours. It is done so that you can go home the same day. Your recovery time is about 4 to 6 weeks. During that same period, you have to wear special garments to allow the contour to be improved while you heal. Can this procedure be combined with other cosmetic procedures? Yes, it can be combined with other cosmetic procedures. Typically, it's combined with a breast procedure, either a breast reduction or a breast augmentation. Still, a person having that particular set of procedures can go home as an outpatient, and we manage those patients the same as we would do for the abdominoplasty or tummy tuck alone. 4 to 6 weeks worth of healing and frequent follow-up in our office. I also get the common question from women, particularly, obviously, can this be done with a gynecologic procedure? Well, that depends on the type of procedure. I would have to sit down and speak with your gynecologist to make sure that the type of procedure is common and can be done in conjunction with my procedure so that you can have the best and the safest outcome possible. Another common question I get is, well, how long is the scar going to be and where is the scar located? The scar is in the bikini line low. It goes from hip to hip, and that's usually typically known as a full abdominoplasty or full tummy tuck. From that incision that's hip to hip, I'm able to lift up the skin, tighten the tummy muscles, and remove any excess skin below the belly button. Sometimes you can have a mini tummy tuck or a mini abdominoplasty. The word mini means small, which means that the incision is smaller. It doesn't go from hip to hip. In that procedure, I cannot do as much as I can do in a full tummy tuck, but I may not have to. You have to be an appropriate candidate for that. I usually only tighten the tummy muscles from the belly button down and remove modest amounts of fat and excess skin in a mini tummy tuck. So, depending on the type of procedure, you have to be the right candidate for that, and we'll try to fit that procedure which will give you the best outcome.